Okay, we're set. Okay, take it away, Max.
Hi. Hi, Courtney. Hi, Malcolm. Hi, Doc. We'll bring you in after. Welcome to Courtney on Health, a Zoomcast series about how to survive the COVID pandemic with tips on nutrition and exercise given by Courtney Gravenesse, registered dietitian with a CDN Master of Science in Nutrition and Applied Physiology. I can always say psychology. I don't know why. Courtney is an experienced nutritional and health consultant in the New York metro area and will guide you on a path to wellness and health. So, give me some skin. The 1960s brought with it bell-bottom pants, the Beatles, the sit-in movement, and the festival of all festivals, Woodstock. In a decade of peace, love, and understanding, the 60s had some slang words and terms that are still used to this day. One of the more popular phrases was, "Give me some skin." No, it wasn't the mantra of your skin doc, but this 60s slang term was used to ask to shake hands in hello, goodbye, or as a way of arranging a deal. For example, "Hey man, how's it going? Give me some skin." During pandemic times, shaking hands is a no-no, and now we think more about washing hands than shaking hands. Frank Sinatra sang a song written by Cole Porter with the word skin in it called "I've Got You Under My Skin." And guys who play pickup basketball often delineate teams by playing shirts versus skins. If you are an entrepreneur on Shark Tank, you must have some skin in the game. So now you're thinking, how does this relate to today's show? But alas, there was a connection because the key word is skin. The topic today is food for fabulous skin, and we have a special guest which Courtney will now introduce. So Courtney, who's this wonderful guest?
Wonderful guest is Dr. Dorian Gravenesse. She is with us from Scarsdale Medical Group, which is an affiliate of White Plains Hospital. I'll give you a little background about Dr. Gravenesse. She received her medical degree from Stony Brook Med and completed her postgraduate training from Yale New Haven Hospital and New York Hospital Weill Cornell. In case you have not connected the last name yet, she is also my sister. So
Oh my God, I wouldn't believe it.
And wonderful. And she's a board certified dermatologist and she's a fellow of the American Academy of Dermatology. So we welcome Dorian, and we have lots of questions today about the topic of nutrition and how it relates to our skin. And we have a shortened list of it. Did we lose Dorian?
And she just left us.
I know. That's okay. So what I'm going to do a little bit of information about. Oh, hello again.
I'm having technical issues. I'm so sorry.
It's okay. It's all good. You missed your fabulous intro that I did for you. So Dr. Dorian Gravenesse, and board certified dermatologist and a fellow of the American Academy of Dermatology. So Dr. Gravenesse, we have questions today about how the foods we eat, things we drink, maybe supplements we take affect our skin. We know it's often stressed to eat, the importance of eating a healthful diet with fruits and vegetables and antioxidants and fiber and healthy fats and polyphenols and all the wonderful things, staying well hydrated because of the association with decreased risk of disease. Now we hear more and more about how it may affect our skin, may even improve or maintain the skin that we are in. So we would love to reach out to you to help us unpack some of these questions that we have about supplements, nutrition, and skin. So we would love to hear your thoughts. I would like to start initially with maybe the topic of skin cancer and a couple of the bits of information I read about foods or compounds that may actually help reduce risk of skin cancer. So at the top of that list would be things like antioxidants, so selenium, polyphenols, foods that might be high in vitamin C, vitamin E, zinc, and A. What can you share with us about their association with maybe reducing risk of skin cancers?
So a lot of the antioxidants, vitamin C, vitamin E, are available in obviously supplement form. And what we are not clear on is whether those supplements taken in the normal RDA doses, whether they're helpful for treating skin cancer. We do know that using them topically, they act directly on the skin to prevent skin cancer by, we call it quenching free radicals, which basically shuts down any of the damage that the UV light that is in sunshine does to our DNA. And it does so immediately right on the skin. And so there are many compounds available, vitamin C and vitamin E in topical serums. They're very effective at preventing skin cancer. It has to be the right formulation though.
Otherwise, they're not stable. So if sunlight reaches these things like a vitamin C or a vitamin E serum, it's going to decompose them and it's not going to have any active effect on your skin at all.
Okay, I have a question for you, which you know, regarding skin cancer. When I was a teenager, we used to go to the beach with, you know, oil we put on our skin, and then we took a reflecting glass, a reflector, to get a suntan. And now all this supposedly is bad because of skin cancer. Was that always bad, or was that a changing of the ozone layer, and that there was more, you know, bad rays that were coming out now than it was then? Or should I worry about it, you know, after 50 years of bathing in the sun?
Unfortunately, lots of things we do from decade to decade, we realize in retrospect, not such a good idea. And I was there with you. I was, my sister will, you know, attest to this. We were major sun bunnies in the 80s. So we did enjoy the beach. Reflectors were one way of increasing the intensity of the sun so that we could get a better tan. And baby oil application was the same idea. Wasn't such a good idea. It probably wasn't such a good idea then, but what we know now is that we understand better how the sun's forces work on our skin and how it can cause a lot of deep damage to the skin. What's also changed is that we know that getting tan is not a good idea. We weren't so convinced of that in the 80s. Now we know for sure that in addition to being sunburned, being suntan is something that actually creates damage in the skin cells.
So, Dr. Gravenesse, would there be, so obviously eating a diet full of, you know, these compounds that we just spoke about, there's certainly no harm, but if I'm hearing you correctly, the research is really in greater support of topical application, or I have been reading about vitamin B3 in particular, which may be helpful in a supplemental form, because the dose, at least to my understanding, which I think is 500 milligrams twice a day, is really almost impossible to get in pure food form. Could you maybe speak about the research behind vitamin B3?
Sure. So vitamin B3, also known as niacin, available in lots of supplements. It's a B vitamin, as you've said. It's water soluble, so you can't really get to toxic levels. It's your body can only hold a certain amount on board, so you can't get into too much danger with it. And a study was done in the last 5 years showing that the amide form, so nicotinamide or niacinamide, it comes under both those names, used at the doses that you just suggested, 500 milligrams by mouth twice a day. The study was done in people who already had skin cancer or precancers. This would be squamous cell, basal cell, or actinic keratoses. And they were noted that there was a 25 to 50% reduction in the number of skin cancers that they developed over the ensuing year. The interesting catch to it, though, is you must stay on it, because as soon as you stop it, you revert back to the
same risk you were before.
Correct.
Okay, but still optimistic, and something that is easy and accessible and reasonably priced. So certainly an option for people who, like you said, are at risk.
Yes.
So,
Yes.
let's maybe shift gears to, let's talk a little bit about acne and maybe those foods or compounds or things that might either aggravate acne, no matter what age, or maybe be helpful. So I've been, my understanding is foods that have a very high glycemic index. So for those of you not familiar with glycemic index, it's basically the big rise in blood sugar that occurs after a particular food. Normally those foods are very refined sugar products. So think, sweets, treats, plain bread, things like that, that might, or candies that may cause this rise, that they may be associated with outbreaks, acne outbreaks. Could you speak a little bit about that?
Sure. So, the data is not that clear cut with acne, because what we do understand is that your genetics really override anything that any dietary intervention can do. So, we can talk a little bit about nutrigenetics. Basically, how does nutrition affect the individual's genetic makeup? Because if you are genetically prone to acne, then yes, foods with high glycemic index will make you more prone to have flares, possibly not respond to fairly traditional therapies. And also, we found that the other, in addition to glycemic index, is also whey protein, as well as the protein in heavy amounts of skim milk. So we looked at milk consumption in young people, and we found that yes, with increased dairy consumption, there was an increase in acne. When we eliminated dairy that contains hormones, for example, we used hormone-free milk, we did not notice the diminution that we would expect. So we do not think it's the hormones that unfortunately sometimes is present in some dairy products. We really believe it has something to do with the proteins. And in that same argument, skim milk actually seems to be worse than 2% or whole milk. So it really does seem to be that concentrated form of the protein that tends to be more likely to make you more prone to acne breakouts. Yes.
But in particular, perhaps that whey protein that's often found in like shakes, like I don't want to name any brands, but things that are typically used by weightlifters, bodybuilders, that have a very high concentration of that whey protein.
Right. If I could get any message across to young moms and dads and coaches, because some of the worst cases of acne that I've seen were in teenage boys who were advised to kind of put on bulk. And so they were given various different protein shakes to try to increase their caloric intake. And we were not able to get their acne under control until we stopped those. And then they responded to pretty traditional acne therapy. So it was very rewarding, and it would be a good message to get out to the coaches. So maybe we have some coaches out there listening.
At what age do you outgrow this? Or do you outgrow it, where you can eat the junk and not get the acne?
I don't know if we know the answer to that. And there are some people who eat junk all their life and they never have a pimple. And others who, I've got 40-year-old women who say, when their diet gets a little bit off kilter, this pandemic has not been easy for a lot of people, it can definitely trigger their acne. Because again, the diet is not the full picture when it comes to a skin condition like acne. So I don't think there's a good answer. It's a very good question, but I don't think we have a good answer to it.
Does tension or aggravation, does that lead to acne also? They say, oh, I'm very nervous, very tense, very worried, and I'm breaking out. What is that connection?
Right, so we do know that stress actually increases cortisol levels, and cortisol levels can actually increase your sebum production. It also can be somewhat anti-inflammatory, and so we do see that acne is worse when people are under significant stress. So yes, that observation we do see, it's written about, and it's also, we see it in practice.
Interesting. So before we leave dairy entirely, I just want to make sure that we have a good message, and we don't scare people away from eating dairy products. So really it's more the whey protein, and maybe a case by case. So maybe if you've got a teenager or somebody who's having an outbreak, maybe work backwards from there. But because dairy products or other dairy foods might be such a great source of calcium and vitamin D, we don't want to necessarily clip that out, but maybe certainly be observant if you've got a case where it's aggravating your child's acne, maybe pull back from there. Is that a good recommendation?
Exactly. It's always a really important conversation to have with the patient, the youngster, and also the parents, to understand that this is the time to make sure your bones have enough calcium in them. So if you happen to enjoy dairy products, get your 2 servings, 8-ounce servings a day on board. Otherwise, we really should talk about supplementation.
You had
I
mentioned
have a
some-
question about protein again. I'm sorry. The proteins that get added to shakes, you can go to a place and get protein shakes. I had an experience of doing that one time, and it was a really bad one. I broke out in rashes, and I had no idea why. And finally, when I went to the dermatologist, they went through like, what did you eat? What did you drink? And I said, well, for the first time in my life, I said, yeah, add protein to that shake. And they went, I think we might have, gotten to the problem just in the process of elimination. So people have to be, I think, careful about, those protein shakes, like you mentioned, and especially in the gyms and all those places. And it could have a problem. And I'm a poster child for it. So just wanted to mention the proteins again.
Oh, I'm glad they were able to figure that out for you.
Yeah, that was stump the doctors. It was like they couldn't figure out because I never had rashes like that. I'm luckily I didn't have acne. All the people would go, if you eat too much chocolate, you're gonna get acne. Is that true?
No, actually, I spent my entire teenage years avoiding chocolate, because at the time we really did think chocolate was acneogenic. And then just after, when I got into college and medical school, in those years, there was a great study that came out of, you guessed it, Hershey, Pennsylvania, done with Penn State students, feeding them 2 groups, controlled. Some had access to all the Hershey's chocolate that they could possibly imagine. And the other group was advised to try to limit as much as possible. And they noticed no difference between the 2 groups. So I happily eat my chocolate.
Me too.
I remember when I was a teenager, there were several kids on the block that had these really bad, they called it acne. I don't know if it really was, but they had the blotches and almost like the scar tissues that they never really outgrew. What is it cause? It is hereditary?
Yeah, and there are some very severe forms of acne. So, there are many who just suffer with, for women, premenstrual, a couple of breakouts, and for boys, maybe just a couple of breakouts throughout their teenage years. And there's other people who really suffer with what's called nodulocystic acne. And we have wonderful medication for that now, which works beautifully. It's a very serious medicine, but it works beautifully, and it's a vitamin A derivative, and so it's one of the better uses of vitamin A and high dose supplementation. But I don't know if you wanted to talk a little bit about that in the form of, we know topically tretinoin, which is tretinoic acid, which is a vitamin A derivative, is the mainstay of acne treatment, has been for the last several decades. Along with that is the oral form. It had been called Accutane by the original company that came out with it and patented under that name. That's no longer available, but its generic form, or isotretinoin, which is a vitamin A derivative, orally available for these people, as you mentioned, with this very serious nodular, cystic, scarring acne that we're able to use, and we have to monitor them because we're actually supplementing them with doses that are almost at sort of vitamin A toxicity doses. So they need to be followed on, regular lab work, and watching for side effects, but it's a very effective medication.
Yeah, because that has, that has really affected some people. I know affected their lives, because they're ashamed to go out, so to speak.
Sure.
Yeah, it's nice that there are options certainly, available to some, people. So that's great. So, if we have a few more minutes, I would love to move into the world of vanity as we go into skin texture and wrinkles. And oh my gosh, there is just a plethora of products and things and lotions and potions available out there. But I'd like to, have you weigh in. I can't call you Doc. I gotta call you Dor. Calling you Dr. Gravenesse is about as natural as me. So anyway, we're just to talk about the three that I heard the most information about, and I would love for you to really, if we have time, to get into sort of the topical application for it versus supplementing with it. So, and I know that there's a difference. Some supplementation of these might not be effective, but topically, yes, just like you mentioned before. So at the top of the list would be, I was going to ask you about coenzyme Q10. People shorten that to CoQ10, which is, we make it in our bodies. It's like we have less of it as we get older, but it's a compound that helps generate energy in our bodies. And I have seen it both in a topical formation, and then I see it all over the place, and including by some of my clients who take it in the supplement form.
Right. So it's never been proven to help skin in the oral form. What it is a very lipid soluble antioxidant. It is used in supplementing some cardiac patients. There's certain cholesterol lowering medications that it's actually used in combination with. So I won't comment on that. I will comment on orally. We have no evidence that it helps your skin. What I will say though is topically, again, since it is a wonderful antioxidant, so it's kind of like a Pac-Man for, I may be aging myself by using that analogy of these sort of a way of coming into your skin and getting rid of all the stuff that doesn't belong there. So as sun comes in, damages your DNA, you've got broken DNA. You don't want that there. Well, any of the topical antioxidants, including CoQ10, can actually provide that for us. It also, because it's lipid soluble, is a wonderful emollient. So if you have it in a product and you apply it, it's going to give a nice sort of plumping and moisturizing feeling to the skin.
Now, as I'm getting older, the thing that I get concerned about with my skin, two things. Number one, I notice I develop more skin tags, like under the arms or around there. And also the liver spots, where I see on my eyes now, you see what's called liver spots. And anytime I go to the doctor, they say, it's age. Is there anything you could do about it, or any supplements we could take that would benefit us?
For the skin tags, no. I'm afraid that they are genetic, and there's other factors that can make you more prone to that. However, for the liver spots, which is really controversial why they're called liver spots. Some say it's because it looks like the surface of the liver. Others say it's because it was believed that it was a sign that you had damage with your liver, and they actually do look a little bit about the surface of the liver, but that's neither here nor there. They're the brown spots that you kind of see on you used to see on your grandmother. I'm sorry if you have them, but you have them on sun exposed areas. And there are topicals that can help with that. The vitamin C topically can help that, because again, it can help reverse some of the sun damage that's causing those spots to be dark. It's not a miracle cure, but perhaps that in combination with tretinoin, which was that topical form of vitamin A that I spoke of. And of course, my favorite, sun protection, is you're not too old at any point to prevent the marching on of time, which is what happens when your skin continues to get sun exposure.
What degree of sunblock do you advise? Because now it all goes up, from 5 to 100. Is there a
little hard to find 5? There are people who are out there who do get their hands on it. We don't advise anything below 15. And we actually, as the Academy of Dermatology and the Skin Cancer Foundation, both advise at least an SPF of a 30. So 30 or higher. And the other key
Even in
is on broad spectrum. Sorry.
Even in winter months?
Well, yeah, skiers who are on high mountain tops getting exposure to ultraviolet rays up there, absolutely
Okay.
needed on any of the parts that are exposed. I mean, by the time you have your, mouth guard, eye guards on, a helmet, you probably don't have much skin exposed, but any skin that's exposed should have an SPF of 30 or higher.
Okay, great. That's good info. And I have a feeling I know where you're going to go with this one, but I still want to get your intake on collagen. So, I mean, it is just like the social media, it is on fire, like, people consuming it. And I feel like when somebody comes to me and asks me about weight loss and they say, well, I want to just lose the fat from my stomach, there's no miracle way to reduce the fat from your stomach. Your body's going to lose it where it's going to lose it. And I feel like with supplements that we take orally, that it's kind of the same way. You can't program whatever supplement we're taking to go towards one specific function. It's going to go to a variety of those. So maybe you could speak a little bit while we have some time about collagen.
Sure. So, collagen is part of the brick and mortar of our skin. It kind of what sort of holds up the outer layer of skin. It sits between the outer layer and our fat layer, along with a lot of other substances. But you can't eat collagen and get it into your body. We need collagen. It's the most ubiquitous protein we have in our body, and it's a very important protein. But the only way you're going to make it is if your genes decide that you're going to make it. So eating collagen is not going to help you make more collagen. In the same way that if you want to make muscle, you don't, eat a steak, that you have to eat the building blocks that will then help your body. And then with exercise causes us to break down muscle and build up muscle. So by doing that and having then all the supplies to make the muscle, which is in good eating of any lean protein source, mixed amino acids, could be plant-based, meat-based, you then build muscle. It's the same thing for collagen. You need the building blocks, but eating it in its natural form is not really going to help you. You break it down in your stomach anyway, and it gets degraded, and then you're going to use the parts.
So if I do weight training, would collagen help me to, build up I guess, the skin tone, or would it be no use at all?
No, it really is not going to do anything for you. I mean, the underlying muscle will build itself through you doing your weight training. And in terms of building collagen, the one thing we do know that will help is applying topical vitamin C. It has to be in a very specific form, the L-ascorbic acid, and it has to be at the right concentration. And when it is applied, let's say to facial skin, it can actually increase collagen production. It has been shown in very good controlled studies looking at sort of driving that enzymatic reaction. Vitamin C is a cofactor in the production of collagen, and that's why we know of vitamin C being used as a great anti-aging product, not just for its antioxidant effect, but also because it does help the production of collagen. So you can certainly
look for that specific L-ascorbic acid. That's
yes.
what consumers should look for, L-ascorbic acid in whatever product they're buying.
Correct, and it should be at least 15%, and again, should be in either a closed pump bottle, so no air can get in because it's easily oxidized, and then it doesn't work. Or a brown bottle, it can't have sunlight or air, so it's a very finicky molecule.
All right, very, very helpful. Well, this has been incredibly valuable. I feel like for anybody trying to do whatever they can to improve their skin, reduce their risk of skin cancer, help maybe if there's an issue with acne. So I thank you, Dr. Gravenesse.
Well, may I call you Dorian?
Sure.
Okay. One final question. We're almost out of time, which now is popular. There are a lot of salves and creams that are containing some forms of marijuana. To ease arthritis, to
CBD, yeah.
yeah. Do you recommend anything of there? Is there a real cure with that, or a real purpose of that, or it's just popular for the time?
Well, it is popular for the time, and there are lots of good formulations out there. I would say mostly what I've seen is for more arthritic complaints and muscular complaints, and then orally for more of the psychoactive effects. I've really not seen any good peer review journals talk about what its use in the skin could be. But maybe by next year we can do this again and I'll have more information.
I want you on more than a year, because there's so many questions that I do have, and I'm sure your sister has and Max has.
I haven't gotten to anything. So it's like, I'm just still, I threw in something to Courtney about, because everyone's washing their hands so much now and everything's getting so dry. What can we do? I mean, what do we just use lotion, or, because at this point, people are washing their hands more than ever, and everyone's just getting that dry skin, so I've been using vitamin E oil sometimes. Is that a good thing?
Coconut oil, there's lots of good. You can buy a jar of Crisco and use that.
And just stick your hands all the way in, and it,
Yeah.
You ever stick your hands in a Crisco can? I did once. Anyway, so,
guys, would you believe it? Our half hour's up.
It went too quickly as usual. So,
is there any way we could contact you, or email, or could we read your book? And if you don't have a book, could you write one, please?
I'll need my sister's help for that.
Okay.
that's a good idea. Let's get that going. So
there's information on Scarsdale Medical Group's website, which is where I have been working for the last 10 years. It's an affiliate of White Plains Hospital. So, there's information there, and anyone's welcome to call if you have any further questions.
Wow, that'd be great. So thanks for joining us for Courtney on Health. To get more info, follow Courtney on her Facebook page, which is Courtney on Health, and Instagram at CLG Wellness, and her new website. What's your new website, Courtney?
See now, we're going to hear that word Gravenesse so much now, it should be ringing in the ears. It's CourtneyGravenesse.com.
There you go. For more shows, go to malcolmpresents.com and theManyShadesOfGreen.com. And remember, Courtney on Health, smart, sound nutrition, strong, safe fitness, and we'll see you again next time.
Ta-ta. Thanks again.
Thanks,
Thank you. Thanks for having me.
Thanks, Dr. Dorian.
You're welcome.